afternoon and welcome everybody to today's webinar. We appreciate you and we appreciate your time. We have a couple of guest speakers with us today. We will be speaking with Aaron Graves and Rebecca Seguin-Skrabucha from Bodman.
Okay, so good afternoon, everyone. My name is Aaron Graves. I'm an attorney with Bodman PLC, chair of our workplace law group. Thank you for joining today's presentation. Special thanks to Megan Tastani and David King at Red Level for making this presentation. COVID-19 is having a wide-ranging impact, and we have been providing guidance on a wide range of questions, including Michigan paid leave act implications, numerous staffing issues, FMLA and ADA implications, attendance issues, safety and OSHA issues, confidentiality and HIPAA concerns, medical testing of employees, whether the FFCRA, Family First Coronavirus Response Act, applies to particular employers, also what the FFCRA provides as far as emergency paid sick leave and emergency family medical leave. Finally, as you are likely aware, our governor has issued a number of executive orders. Now, my understanding is that we may have some callers on the line who are in states other than the state of Michigan. For those individuals, you need to look at your particular state circumstances because the government is responding to this emergency on a state-by-state basis. Executive Order 21, which shut down many businesses but allowed essential businesses to continue operating with critical employees, was extended by Executive Order 42, 59, 70, and then 77, which continued to stay in place mandate through May 2020. We also have executive orders which extends unemployment eligibility for folks that would not otherwise be eligible for unemployment. In the state of Michigan, that's up to $962 per week for many employees. Also, in the state of Michigan, we have Executive Order 36, which protects the employment of employees who cannot work because of COVID-19 related reasons, and which prohibits employers from taking retaliatory action against employees for failing to document their reasons for missing work. Essentially, under 77, Executive Order 77, it extends the mandate through May 28, 2020, but it allows certain industries to continue operating again. So for the landscaping, construction, real estate, and manufacturing industries were impacted by this latest executive order. These businesses can conduct in-person work, but they do have to provide some precautions. For example, they have to provide non-medical grade face coverings for all employees. Those you do not have to require that the employees wear them. We recommend that you do, but that raises a bunch of other issues when you have employees that may say, well, I can't wear the face mask for whatever reason. Each employer who is operating in the state of Michigan must maintain a COVID-19 preparedness and response plan. Each employer must limit the number of people to no more than is strictly necessary to get the work done. You need to promote remote work to the fullest extent possible. So if you do have the ability to have your employees work remotely, you should do so. You also need to require social distancing and increased facility cleaning and disinfection, and adopt a daily screening process for your employees. That will involve, taking their temperature, asking whether they've been exposed, and having them fill out a little questionnaire. So if for the workplace modifications that are required before we return employees to work, in the construction industry, we have to designate a site-specific supervisor to monitor and oversee your plan. That person needs to be familiar with the COVID-19 plan and needs to remain on site at all times during activities. If you're a construction industry employer on the call, it doesn't need to be a supervisor necessarily. It can be another individual like a lead that would be responsible for that plan. Also, we see that these limitations are going to be extended to other businesses. So anyone else who plans on opening, we recommend that you do have somebody who is your kind of your lead person on the plan and who's familiar with the plan, that you should have that point person on site at your facility at all times. In the construction, they also need to have a daily screening protocol, just like other employers. They have to require face shields or masks when social distancing cannot be consistently maintained. So in other words, if you've got employees working within 6 feet of each other, our recommendation is that they have either masks or face shields they wear. You need to have instructions for PPE distribution and disposal, and also identify and mitigate choke points in high-risk areas. What does that mean? That means if you try to disperse people at those points, for example, that may be where somebody is punching in or punching out. In manufacturing, you need to train workers on virus transmission, symptoms, and PPE. We do have some materials that we prepared to help employers do that. Essentially, what you'll want to do is give them the CDC guidance that you can get on their webpage and walk them through that. Flexible scheduling is required. I'm not exactly sure how that's going to be implemented for many manufacturing employers. I can see that as a great difficulty. One way that you may want to consider doing that is staggering shift start times just a little bit, because you are going to have a backlog of employees coming in and out when they're going through the screening protocol. That may help you save some of your some wage hour costs, because when employees aren't in line waiting to check in, and when they're actually getting screened, we need to pay them for that time. That's compensable time. You need to establish a process in case there is an exposure. That means you have to clean certain areas where the employee was. You may have to notify other employees, and you need to maintain a log of exposure.
So now we're going to talk about what should be included in your preparedness and response plan. So as a baseline, you need to discuss prevention efforts and workplace controls that you're taking. Basically, what cleanliness and social distancing techniques have you implemented? And then more substantively, you need to identify the procedure that you're using to identify and isolate sick and/or exposed employees. So that starts with employee self-monitoring, making sure that employees are aware of COVID-19 symptoms and that they are not reporting to work if they have the symptoms or have had close contact to someone either with symptoms or a COVID-19 diagnosis. And then when your employees actually enter the work site, you have a specific daily screening process at dedicated entry points. Make sure that employees aren't able to skip the process by entering through a back door. So in your daily screening, you are most likely going to be performing a temperature check. You're going to be asking whether or not employees have a set of symptoms, whether they've had the close contact, or whether they've traveled domestically or internationally in the last 14 days. Now, with this process, you are going to want to maintain a documentation that this was performed each day. And so this could be on some sort of paper form, or like Megan is going to describe later, using the COVID-19 app. And so the importance of this daily screening is that we have an executive order requiring it. We have specific county levels requiring it. But if you're able to ensure that you don't have sick employees entering the work site, it's going to save you an OSHA or workers' comp headache later. And then you also want to specify what you're considering your return to work requirements. If you have a symptomatic or diagnosed employee, what are you going to require before allowing them to re-enter the workforce? So you can follow, based on the CDC, either the test-based or the symptom-based strategy. For test-based, employees need to have received 2 negative COVID-19 tests at least 24 hours apart. If you're following the symptom-based strategy, they need to have been at least 3 days without a fever, without fever-reducing medications, an improvement in their respiratory symptoms, and they need to now be at least 10 days since the onset of their symptoms. So you want to make sure that you're being consistent in defining when your employees are allowed to return to work. And then you also want to include in your plan a summary of your workplace flexibilities and the potential benefits available to employees. Typically, the workplace flexibilities we're talking about are the suspension of attendance policies. So for eligible absences, are you not going to assess occurrences or attendance points? Other benefits available, the new benefits are going to be paid leave under the Families First Coronavirus Response Act. It could be unpaid leave under the FMLA if you have 50 or more employees, or it could even be leave as a reasonable accommodation under the ADA. So you want to make sure that you have a summary of those benefits available to employees to review in your plan. And so initially, the plans were only required to be maintained on site at the headquarters. Now we're recommending that employers distribute their plan to employees, one, so that they feel safer about returning to work, but two, so that they're aware of the procedures that are in place and the procedures that they themselves need to follow. And three, if you're in the manufacturing industry, you're going to attach the training modules from the CDC, and it ensures that with assigned acknowledgement, you are documenting employee training. The OSHA guidance on which the preparedness plan is based requests that employers classify their workforce into categories depending on exposure risk. And so if you're low risk, that means that your employees do not frequently interact with the general public, and between coworkers, they're able to maintain 6 feet of social distancing. If you're medium risk, it means that your workers do frequently or closely interact with the general public, or they're unable to maintain consistent social distancing. High risk and very high risk are going to be reserved for the healthcare industry. So if you have a low risk workforce, you do not need to include any additional measures in your preparedness plan. If, however, you have a medium risk workforce, you need to address those instances in which proper social distancing cannot be maintained. So if your employees interact with the general public, perhaps you implement a physical barrier, some sort of plexiglass, so that they're not communicating directly with the public. If they cannot social distance from their coworkers, perhaps you're requiring the use of masks or face shields. For your high and very high, that basically means that you're providing your employees with appropriate PPE and you're following what's required of healthcare facilities. I'm going to explain what your process is should you have an exposure in the work site. So once you've required your employees to self-monitor, you required them to report their symptoms before entering the work site. So once you have an actual symptomatic or diagnosed employee, you need to ask that employee to identify everyone with whom they came into close and sustained contact in the 48 hours preceding their onset of symptoms. This allows you to properly notify employees who may have had the potential exposure. There's a bit of a distinction between who you need to notify and who you need to remove. So employees who had close contact, that means you're about 6 feet away on a somewhat consistent basis. That person needs to receive a notification of the exposure, and they are encouraged to continue self-monitoring, as all employees are. If, however, the employee had that sustained close contact, meaning they were interacting with the symptomatic employee within 6 feet of distance for 10 or more minutes, that's going to rise you to the level of sustained contact, and that person needs to be removed from the worksite for at least 14 days because they've now had close contact with the diagnosed or symptomatic individual. Importantly, you need to keep confidential the identity of the diagnosed or symptomatic employee. It's likely that employees will guess, but from your perspective, you need to maintain confidentiality of medical information. And then you need to perform your cleaning protocol. So the most recent executive order asked that manufacturing facilities resuming work have a cleanliness plan. And so the basis of your plan is going to be that once you have an exposure, you increase ventilation, you cut off access to and conduct a deep cleaning of the symptomatic employee's workstation, and that you disinfect common areas. The length of time in which you need to cut off access, the length of time in which you need to increase ventilation is going to be dependent upon your work site. But typically, the CDC is recommending that you increase ventilation for about 24 hours before even commencing your deep clean. And so again, that's going to be employer dependent. This is just going to be a quick summary of the changes that we've seen in employee leave options since the commencement of the pandemic. So unemployment compensation benefits have been expanded, both in terms of eligibility and amount and duration of benefits. So Executive Order 2020-76 says that now eligible for unemployment are those individuals who are immunocompromised, who are experiencing COVID-19 symptoms, who have had close contact to a confirmed diagnosis of COVID-19, those who are caring for someone with COVID-19, and those with a family care responsibility as a result of a government directive, basically the closing of schools. So these are individuals who historically would not have been eligible for benefits, but are now eligible. Separately, the Families First Coronavirus Response Act provides paid leave under both the Emergency Paid Sick Leave Act and the Expanded Family Medical Leave Act. This is employer-provided paid leave, but If you maintain proper documentation and you approve in accordance with DOL and IRS guidance, you can receive a tax credit back reimbursing you for monies given to employees in accordance with this leave. The leave is designed for employees who are advised to self-quarantine or self-isolate, either under government order or from a healthcare provider. For those experiencing symptoms and seeking a diagnosis of COVID-19, those who are caring for someone under a self-isolation order, those who are caring for their son or daughter whose school or child care provider is closed or otherwise unavailable, and then for symptoms identified by the Secretary of Health and Human Services. This is, I think, designed for a situation in which COVID-19 becomes a different, similar type of diagnosis, and so we don't have any guidance yet, and we should not be approving leave on that basis just yet. Essentially, employees will receive their full salary if they take reasons related to their own self-isolation or their own symptoms. They're going to receive 2/3 of their salary if they're caring for someone or caring for their son or daughter whose school is closed. And then let me say really quickly though, those requests should be made in writing. And so we do have an employee leave request form that we're advising our clients to use. And it's going to request the documentation that's needed to submit to the IRS to make sure you get the tax credit. And so documentation right now is a little bit difficult. You want to maintain the requirement that employees provide you with as much information as possible before approving or denying their leave. But there is going to be perhaps some flexibility if an employee comes to you and says that their healthcare provider simply cannot provide the documentation that's appropriate. But at least at the outset, maintain the requirement that employees submit documentation. And Aaron mentioned earlier, we have Executive Order 2020-36, which is anti-retaliation protections, both for those with COVID-19 symptoms and those who have had close contact. And so that's what's also defining the requirement that employees be out of the worksite for at least 14 days if they've had close contact or live with someone with symptoms or a diagnosis. And then your traditional leave and accommodation rights, if you have 50 or more employees, it could be that your employee is suffering from a serious health condition that would entitle them to FMLA leave, or that they're caring for someone with a serious health condition, so long as that person is a family member. And then we also have the Americans with Disabilities Act, which says that if an employee discloses a disability to you, you need to engage them in the interactive process and determine whether or not leave would be a reasonable accommodation in the situation. All right, and then the next slide, we're just going to discuss one of the most frequently asked questions that we receive, which is, let's say you are resumed activities under the executive order, and you have employees who are now refusing to report to work. You've sent them a return letter, you've set a return date, and they're now contacting you and refusing to return. And the first thing you want to do is ask that the employees submit a written statement articulating the reason for their refusal, because the reason they provide is going to affect how you respond. If the employee cites a health-related reason that would be protected under the FFCRA, the FMLA, or the ADA, you need to engage them in a conversation to determine whether or not leave is appropriate. If they cite an NLRA or an OSHA concern, basically saying that returning to the work site could cause them serious injury or death, what you want to do is refer them to your preparedness plan, outline all the ways in which you're making return to work safe, and that should minimize both their concerns and any inclination to want to report an OSHA claim. The employee could articulate a reason that would make them eligible for unemployment benefits, but if that reason is not otherwise protected under the FFCRA, FMLA, or ADA, you do not have to allow an employee to take a personal leave of absence so as to collect unemployment. You set a return date, you're allowed to expect your employees to be there. Commonly, and I think what we'll see an increase in, is employees who are simply saying that they're afraid to return to work. General fear in and of itself is not going to rise to the level of protection. So if you set the return date, the employee simply says, I'm scared to return, you can assume that they voluntarily resigned. But before you make decisions, you want to assess your comparators. What have you done for other employees, specifically with regard to protected characteristics under state and federal law? You don't want to approve leave for one and deny for another without having a legitimate reason as to why. And then you may want to modify your incentives. Explain to employees that if they continue a leave of absence, we could cut off their health benefits. They're losing access to long-term security. There are various conversations that you're going to want to have based on your work site and your employees and knowing what will encourage them to return. And then the last component here is identify your decision maker. Are you going to be approving or denying leave, or are you going to give the employee an option to choose? And so I had a client a little while ago who did not want to provide the FFCRA leave. The employee said that she couldn't come to work because she needed to care for her children, and they would prefer for her to have taken a personal leave and apply for unemployment. So what we did is we laid out in a letter the option of applying for the FFCRA leave, and which she would receive 2/3 of her pay, or taking a personal leave of absence, allowing us to replace her. And then she could collect up to $962 per week through the unemployment insurance agency. And so this put the decision on the employee, and it ensured that the employer did not enact an adverse action. And so I know that that was a lot of information very quickly. We have sample preparedness plans. We have sample employee request forms. There are a lot of different things that are happening right now, so feel free to follow up with us, and then I'm going to turn it over to Megan.
Great. Thank you, Rebecca. I appreciate it. Up on the screen, we have both Erin and Rebecca's contact information. So if you have any additional employment law questions, feel free to reach out to them directly. But for now, I would like to say thank you to everybody that was able to attend. Thank you all and have a great day.